All right, let's talk a little bit about PPE. I'm going to start off with a scenario for you guys. All right, a patient comes to sick call. He's coughing, sneezing, has body aches. The medic puts on a face mask and goes to see the patient, who promptly coughs on the medic's face. And the medic is called to see another patient in the middle of his exam. So he takes the mask off to go see this second patient. Unfortunately, he touches the front of the mask where the patient coughed on him, and he throws the mask out. But then on his way to the second room to see the second patient, he forgets the alcohol gel. The first sick patient gets a quarter slip, told to go home. On his way out, touches the doorknob with his hand, which he coughed on and sneezed on. 5 more patients come in that day to see the medic, who keeps forgetting the alcohol gel, unfortunately. So what's going on in this situation? You've got one sick patient. Who knows what he has? Is it a virus? Is it a flu? Is it pharyngitis? I don't know. So the problem is here that the patient has exposed the medic, who, because he did not handle the PPE he was wearing properly, unfortunately has exposed himself and all the other patients he sees that day to potential infection. Um, I think that's why we're talking about this, just to emphasize what you guys already know, that our main objective here is to protect ourselves and protect our patients. And I would go one step further and say, keep this infection, this coronavirus, from spreading. Okay. All right. Let's talk about some precautions that you'll see in the hospital, clinic, or even a sick call kind of setting. Standard precautions, do it all the time. You wash your hands, or at the very least, alcohol gel before and after you see a patient. And you should always clean a patient room between encounters, even if that's just a wipe down of the table they're sitting on with like a cavi wipe or something. Contact precautions, if there's an increased risk of infection through touching something. If it says contact precautions in front of a patient room while you're rotating in the hospital, you always want to wear gloves and a gown at the minimum, always. You can add on a mask and some eye protection if you think you're going to be in contact with body secretions. For example, if there's going to be blood, pus, or a lot of runny nose or something like that, and you think you need to take extra precautions. Droplet precautions are what we're most concerned about here with the coronavirus. It has been shown to be transmitted mostly by large droplets. These are anything over 10 micrometers. So basically, you want standard precautions, contact precautions, and included in that, you want to put the patient in an isolation room so that there's decreased risk of exposure to other patients. And you definitely want to wear a mask and eye protection, because these methods of infection and transmission are mainly through the eyes, nose, and mouth. Okay. Uh, Lastly, you have airborne precautions, which are different than droplet in that these are smaller droplets and aerosolized particles that are causing transmission of infection. So you're only going to find these mostly in hospital settings where there are advanced procedures being done, such as intubation, bronchoscopy, or nebulizers or something are being used. What you see here, you need standard contact and droplet precautions, plus not just an isolation room, but a negative pressure room to prevent the suspended particles from being continually infectious as you go in and out of the room. And you need a fitted respirator mask, such as the N95. Like I said, I think you are less likely to see this if you're not in a hospital operating room setting. So mainly, droplet and contact are probably the best things that you can do to protect yourself and your patients. Some visuals I want to show you guys. This is a YouTube video that I thought was like really fun and visual, I guess. It's a guy named Mark Rober doing an experiment with kids, and it shows the following things. And I think it's just a fun video. So if you guys have time, it's about 10 minutes long. This is a CDC infographic, which I also demonstrate in my attached video, but how to put on and take off PPE. And here are the references where I got my information from. Okay, if you have any questions, please feel free to email me. Thank you guys.